This book is about relationships between a federalist political system and bioethics. It was conceived when the paramount issue about federalism in the United States seemed to be access to care, with states refusing to access Medicaid. It was initially drafted when 50 years of federal constitutional protection for reproductive freedom seemed increasingly likely to end. And it was completed in the shadow of the Supreme Court's Dobbs decision to return abortion regulation to the people's elected representatives in the states. Our book explores the permissibility of differences about health, healthcare, and public health in a single polity of interconnected subnational units with constitutionally recognized status, that is, a federalist society. Abortion is but one tip of an ever-changing iceberg of these differences, albeit a very pointed one. The federalism of the compound republic constructed by Hamilton and Madison has flexibilities and strengths, but also weaknesses in dealing with morally defined policy conflicts in circumstances of injustice. These features of federalism generate ethical challenges for healthcare providers, their patients, and public health. A further goal of this book is to consider how providers should negotiate these challenges. As authors, we have both practical and theoretical goals. Practically, we identify the relevance of federalism to people facing ethical decisions about health and healthcare. We also aim to facilitate thinking about how to respond to ethical issues raised by subnational variation. Theoretically, we consider justifications for permissible differences among subnational units. These justifications come with conditions, which converge on the importance of effective movement. We also explore whether authority over important aspects of health is misaligned in the United States today, with some matters problematically left to the states and others problematically taken over by the federal government. Federalism has been defended as a political structure that enables people to coexist in a single polity despite deep moral disagreements about some of the most fundamental aspects of human life. But there are limits to the permissibility of the political form such disagreements may take, as Abraham Lincoln averred in his House Divided speech that a nation cannot be half slave and half free. When states are joined together in a single union, what happens in one political unit inevitably affects others, not just because contagious diseases do not stop at political borders, but also because, as Martin Luther King Jr. believed, injustice does not stop at borders either. Preserving the right to move to other subnational units may mitigate the force of significant differences in the recognition of rights. Perhaps, as Justice Kavanaugh suggests in his Dobbs concurring opinion, the right to travel may be preserved even when other rights are not. But even with rights of movement, if a nation is not at least working toward a minimum floor of shared opportunity for all, President Lincoln was right, and there are at least some divisions that a federal nation should not endure.